about personal protective equipment. The government's still facing tough questions about all of that. A lack of equipment, of course. We've heard from so many frontline NHS staff in the last couple of weeks, haven't we? Particularly on social media, people saying they simply can't get hold of enough equipment. Now, ministers saying that the equipment is available, but admit that the distribution is complicated. Well, let's discuss that with Dr. Claudia Paoloni, who is president of the Hospital Consultants and Specialists Association. She's a consultant anaesthetist. Thanks for your time. When you hear that from the government, that the equipment is there, but it's the distribution that is the problem, does that ring true with you?
I think there clearly are problems with distribution of the equipment, and I'm very concerned, and we as an organisation are very concerned that that's the case now before we've even hit the peak. We're ahead of the peak and we're struggling to provide PPE, which is essential to the workforce. So that is a major concern, and it is being confirmed by our members on a daily basis.
Yeah, I'm interested, what are your members saying to you? Because is it a question of we have some equipment, but something that should be used once is having to be used multiple times? Are there some areas where there's nothing? Explain the variations for us.
So the variations we're getting through are cases where we're reusing equipment, or it's being rationed so you can't actually use it in certain circumstances. And the position that we take is that right now we've moved on. We've moved on in the progress of the pandemic, and everybody should be getting PPE at all times with all cases of patient contact and within a hospital setting. And it's really, really important. The guidance needs to change for that. At the moment, there's still a slightly woolly area in the guidance where certain patients may be deemed not to be affected by COVID. However, that's not the case now. We've moved on. We're doing social distancing. We're assuming in the community that everyone is a suspected carrier, and that should be also applied within the hospital trusts and the hospital and community environment. So everyone should be wearing PPE at all times. And that's an awful lot of equipment that needs to be coming out. And if we're having problems now, I would like to know what their position is going on into the future.
I mean, have you had nurses, doctors say to you, do you know what, I can't take much more of this. I'm too scared to work without the proper equipment. If this carries on, I'm just not going to turn up for my shift. I mean, are we going to reach that point?
I think the NHS workers are the NHS workers, and they will always do what is absolutely right for their patients. However, we have done a snapshot of our membership, a snapshot survey. 80% of those respondents are frightened. They don't feel prepared with the equipment that they've been given, and that's a significant amount, and it's unacceptable. That should not be the situation for our NHS health workforce. But they are going to carry on working. They always do.
At potential risks to themselves.
At potential risks to themselves, which could be avoided with the appropriate PPE, the appropriate equipment. And that has to be for all staff at all times, in all circumstances, within the hospital settings and within the community settings.
Dr. Claudia Paoloni, thank you very much for now.